Well, we know all of this. How do we implement it? Where are we going to do this? So I think we have to take and look at what our unit is doing. We're going to have to develop a developmental care program. You know, we know that it's widespread. We know that there are a lot of people out there that can give us some tremendous advice. I think one of the nice things that we have in the NICU community is sharing of ideas, sharing of information, and how we truly can create that environment that is most positive for our infants. Now, things are going to vary from institution to institution. Not all of our NICUs are alike. Some have private rooms, some have, you know, open bays, some have pods. Whatever we have to really take and look at that and try to see how we can take and implement developmental care in our unit. We also know that we have to look at long-term benefits and what this will mean to our infants long-term by implementing this type of care. And then, of course, you know, I think probably when all's said and done, there's really not a consistent definition of developmental care, but it is truly a change in our philosophy and our approach to taking care of our infants and providing an environment that is very conducive to growth and development. I think we have to take and look at what we want to gain both in short-term and long-term outcomes, and I think we have to take and look at what our own individual philosophies are. And I think we have to look at family-centered care, because I don't really think you can say you're a family-centered care unit unless you're really truly practicing developmental care. We need to take and realize that there are many educational, not only is there information that we can gather from our hospitals and from our peers, but there is tremendous educational opportunities that are out there that we all have access to. One of those is NIDCAP, and you know, having our staff trained in the NIDCAP process. We have, you know, usually, you know, with that, there's a 10% of staff that is trained. Sometimes there's more staff than that is trained. But the thing about it is the fact that we sort of have a songbook, as my grandmother would say, or a hymnal to sing out of, so that we all know what is happening, what is taking place, and what we need to be observing for. And then, of course, we have the We Care program that's brought to us from Children's Medical Ventures, and which right now is owned by Philips. So consequently, they have a program whereby we take and educate everyone in the unit so that everybody is got the same football program. You know, it's sort of like having a football team, and the fact that you try to train everybody that's going to be impacting the field so that we can have a positive impact. And usually it consists of an 8-hour day of both didactic and some clinical experience. And then, of course, we've got the NAN certification program, and as we said, that came about in 2008. It's a new program. We have many people that have successfully completed the certification program, and I think that it really, gives us the ability to be active participants and to really make a difference in our neonatal environments. And then, of course, we have to take and look at the fact that there are some annual meetings that will really give us great insight, and that if our hospital is moving forward to a family-centered program or looking at a more developmentally structured unit, that we take and we attend Dr. Stan Graven, Dr. Bob White's meeting that takes place in Clearwater, Florida, normally late January, 1st of February of every year. And then, of course, we need to take and we need to look at the DINC meeting, which is better known as Developmental Interventions, and meeting that is held, I think it's East Coast, West Coast, something like that. But anyways, put on by Contemporary Forums, and I think it's a great meeting that we should take and invest the time and the energy to go, because it does give us some tremendous insight. And then, of course, if we're looking at new design changes and so forth, the Graven meeting, Bob White meeting is a wonderful meeting to go to, because it does give us that. And then last but not least, that I do not have on this slide, is Bev Johnson's meeting that happens every year, and it is the Family-Centered Care Conference. That is a wonderful experience. If you've not been there, it is tremendous, and it's not just for the NICU, but it is actually for the entire hospital. And it shows that how we can integrate that family-centered approach from the emergency room through critical care, through patient rooms, general patient floors, and to our pediatrics and our NICU environment. So, developmental care, what more do we need to do, okay, to convince you today that this is what we need to be doing and how we need to be evolving our practice? We've got data that goes back over 20 years. We've got research that has all been validated. We've got positive outcomes that have been documented as well. You know, developmental care is an evidence-based practice. And, you know, it's really ensuring us that we provide a standard of care and practice that every one of our infants that are in the NICU should have the opportunity to experience. And with that, I'm going to say thank you for your time and your effort, and I look forward to working with you again in the next sequence, which will be on the neurosensory system and its impact on growth and development of our infants. Again, thank you, and have a great day.